Hello. Thought I would do a live video because I am cognitive today, and that's awesome. Also, I'm not feeling well. I am very much in my feelings today. I want to puke. I want to eat like an entire buffet. And I don't have an appetite at the same time, so I have like lots of contradictory feelings and stuff. So I went somewhere or went and got some food somewhere that I haven't been to in a while, but I love very much, and that is Taco Casa. So I got me a bag of tacos. I don't know if you know, but Taco Casa has double the meat for probably like 75 less percent sodium than like Taco Bell, which is our fast food taco place. Trying to like put my feet up in the chair, and of course I've like got the blanket up under the wheels. That's okay. I am in a whole bunch of pain, so a lot of times I've got like a really big blanket. It's one of these Chinese blankets, as my grandmother used to call this because of the type of fabric it is. But like everybody has these blankets now, this type of fluffy fabric. Anyways, I take it and kind of like a seat belt thing, like on a roller coaster, and squish it down around me so I can kind of lean into it and give myself some support. Anyways, so it's not time for me to start shaking yet, but I also don't know how my timeline is going to be with my female cycle. So far, so good. I did not have any blackout, I did not have any complete bad blackout. I definitely had a drop in my mood. It wasn't really intense. There's still not a hole poked in me anywhere, as I can say it, and I haven't had that since it's been about a year and a half since I ended my Lamictal, which is an antipsychotic treatment. I took it for not a full year. I took it for like about right at 9 months, funny enough. And after that, I do not, and still don't, have go into like the psychotic part. I don't go into an epileptic state. And when I say an epileptic state, it is a constant low-grade seizure. It's as if, you have a giant, it's as if you have a pool with, a hole poked in it. It's just constantly draining, at the same time as being filled up, like a hose in the pool and a hole poked in the pool, and the water's just constantly going through. That is an epileptic state. I can talk in that state, I can do everything I need to do, but like I am intellectually disabled, like completely in that state. It is it's super terrifying. There really isn't anything to compare it to. Not only is it super terrifying, but it's also super rare, and scary and confusing and all that kind of stuff, and trying to figure out. Luckily, you know, I am familiar with psychiatric medications because of the year it is and the day and age we live in and stuff. So I started experimenting with those about 17 years old. So as soon as I, with the help of a doctor, kind of ramped it up, I went into the epileptic state, fixed it, stopped it anyway. So I still feel every now and then, you know, going through, even like I just stopped the Lexapro. It's not been a full month, but there's all kind of different things that I treated with those two medications, and it like I can feel at the stage in which I would have that wound again, that it doesn't happen. So and it's not supposed to have never had this problem before this situation and accident and stuff. You know, if it didn't happen, you know, I wouldn't have learned a whole bunch about a whole bunch of stuff. It was like a circle being completed, you know, for a bunch of experiences and feelings and stuff that I had over the years, and I'm like, what is that? What is that? You know? So luckily, I got all that worked out, but it is still super freaky. This is my first cycle that I did not know what was going to happen. I didn't know how it was going to balance out, you know. So I did have the drop in like my mood, where I was just, you know, bebopping around and stuff, working and stuff, and all of a sudden, about when I would have PMS is like the first day is about a week before the cycle restarts. I had just this huge drop, as if I got like hit in the back of the head or something, or kicked in my back. This is kind of what it feels like. No pain or anything like that, just like being done with, you know, everything kind of. Anyway, so that doesn't go back up. Like, it isn't just like, I don't just go to sleep and wake up the next day and feel better. I still feel like that. It's almost like an antidepressant. Ooh. I did just get out and exercise and just got back home, so my blood pressure might be doing a little something weird. Just had these weird pressure headache thing go on. Anyways, it stopped, so so I feel really good. I feel normal, cognitively clear. I of course, like I said, I have been taking Lexapro since the end of last summer, and Lexapro and antidepressants are pain relievers, painkillers, or whatever. And so I knew the next time I encountered something like my female cycle, the pain level was going to be different and stuff. And you know, sure enough, I feel great. I feel fine. You know, I'm in a lot of pain, like, but it's not like my mind is not, and I'm not talking about my thoughts or my coping. I'm talking about my sensitivity level, inherent sensitivity level to pain. You know, this is a thing, like, squeezing. Like, if you're only in level 3 or 4 pain, your grip level is gonna be a lot different from if you were at 8, you know. So, and a lot of people scream and let go, you know, once it's like at 9 and 10. So, that's how the inside, well, like your inside body works too. My hand is still really swollen. It's been fucked up since, both of them are like that, but I'm right-handed. You can actually, I don't know if you can see it on it, but you can, yeah, you can see the difference. This hand is, well, I drive, so this one's got a tan, but, you can see, I guess, like on my ring fingers, the, swollenness. It's a little bit more swollen over here. Also, it's, this is such a thing that you can see the difference in the shape of my nails. This hand is way bigger than this hand. This has been a thing for, I've noticed it for like the last 5 years. 6 years. But now, like, it is what I'm dealing with in the last, like, since Mother's Day, since I started, since I came off the Lexapro, my grip and pain level is, you know, adjusting and whatnot. And so, yeah, my hand hurts. Also, my skin is swollen, but it's not in my face. And I have been dealing with that for each medication. I also took gabapentin for a little while in the last 2 years. It swelled my face. Lexapro swells my face. The Lamictal swelled my face. All of them are pain medications, and they all swell my face. And you can see my face line, like, to tell that my face is not swollen. I don't have any, like, I have a poofy face, but in, like, my skin, trying to see if you see, it's swollen at the same time, but it's like kind of wrinkled too. Looks like I need moisturizer, and that is normal. That is a normal amount of, like, you can tell that it's balancing correctly, rather than, just, and, so, yay. I'm really glad to be able to talk right now and think, I'm trying to think if there's anything else, any other points that I really want to make before I end this, but, at first, in the past couple days, right up until actually the pain starts, which is the female cycle and my cycle, the first day of it and stuff, I have some brain fog and stuff. It's all very weird. It's like fibromyalgia kind of thing, because you don't really feel the pain. It's not like this, you know, where I'm like, ow, ow, you know, and I can point directly. It's like I have pain reactions and my mood changes. So that is a pain response. So that is not something I choose. That is, part of the functional neurological disorder. Like, it is completely beyond behavior, mind. That is something, a way my body is adjusting to, yeah. Anyway, so I am having in this situation, I am having some issues with the Tourette's, and I want to make a comment on that because it is something that I'm not really talking about right now because the symptoms have died down, and I am a person that you know, wants to be exact, wants to say as little as possible, wants to make myself clear as possible, wants to have my life as simple as possible because I have a lot of struggle, and I have a lot of want and will for my life and the people that I care about and the people that are around me and stuff. So, however, I do have full Tourette syndrome. It is in there. It comes up as part of what I'm guessing is that because I have the you know, we'll just, you know, autism, the autism spectrum disorder is just there. And then there's the functional neurological disorder. And I have the PBA. And somewhere in the mix of there, like the Tourette's is like the PBA. It comes and goes. This is who I am, the ASD. That is who I am. That is me, Chelsea, and that is what I was born as, you know. It does have, you know, it is a medical disorder, but it directly causes the functional neurological disorder, which sometimes I think gets mixed up with it, is what I'm guessing. I'm still reading and researching about it. And so that causes outward behavioral, you know, identifiable actions and negatives and positives, like a mental illness. So I have Tourette's, but it is very mild in presentation. The thing is that under certain circumstances, I never have ADHD, but when I am more on a scale of like with my pain levels and my actions, sleep level, like when I'm in this area or that area, for some reason, my symptoms like bloom fully. And it is very obvious. It is definitely 100% Tourette's syndrome. I'm guessing that is part, I don't know. See, the PBA is directly related to the functional neurological disorder. So what I'm guessing is that the Tourette's is also an offshoot of functional neurological disorder. That's what I'm thinking. It's a coping thing. And so that is not a you know, something you go to the doctor for. I would not have, you know, any paperwork for Tourette's syndrome, because it is strictly attached to the functional neurological disorder, and the functional neurological disorder is completely wrapped around and attached to autism spectrum disorder. It is very much like, because on the other hand, I definitely have Madi 2. That is a, get some blood work done a couple times and kind of diagnosis. I have been studying it for 20 years. I had some blood work done at a research chemical. I had a research medical office. I had a friend, or a couple friends actually, who were working there, and they did like, weight loss studies, sleep studies, different, not sleep studies, weight loss studies, different things, and like give you some money for it. So I went and had my blood drawn, and that was the first time that someone was like, you have pre-diabetes. And so I took a gander at the numbers and the levels and stuff, and I was really big then. I was about 230, 240, and I'm 5'10". Very, very, very muscular. I have lost all of my muscle. That's another reason why some of these symptoms have come up, is because I have been through a couple physical changes that have changed my sensitivity levels over the years. And one of them was, 100, because I've gone down to 150. I was 150 last summer, and that's the least amount I have weighed since 10th grade, since I was 15 years old. I felt great, I felt fine, but I also, kind of walked myself down. That is also how, funny enough, using that word, that is literally how I lost the weight. Originally, when I did get up, like, about 15, 20 years ago, up over 200, 230, 240, that is a lot of weight. 200 to, 30, 40 pounds, like, it don't matter. That's a lot of weight. Especially to somebody who has neurological disorders, especially to somebody who has sensitive nervous system. So, there is a lot of, that happens to anybody and everybody. Gaining weight affects your nervous system. That's the reason why people have, temporary diabetes, is because of pain. So I definitely self-medicated with food for a while, and I lost it by, going to work at Domino's and as a delivery driver. And just walking, and I'm not one to self-medicate, so, I actually was around people who eat a lot for the first time in my life, and so, I gained a lot of weight. Also, different types of food stick with you more, than other foods do. I'll take a bite of this. So, I had to learn about all that. Lost a little weight. It's been a struggle over the years since then, because it's kind of weird. Sometimes, I can eat a pizza and, a whole bunch of shit for a whole week and not do anything. Sometimes I'll go through a period that, like, everything sticks to me, and that has to do with my neurological conditions, and also, which affect how I cope, and also I've gone through medication things, so shit's weird. I don't have a personal dietitian or anything, or I live, or I'm not married, let's put it that way. I don't eat with anybody else on a constant thing, so sometimes I forget. Alright, waking up today, and I'm like, ravenous, but at the same time don't have an appetite. If somebody would have called me and been like, hey, can you help me with something? I could have gone all day without eating. And a week ago, you know, my body would have told me that, you know, I'm going to die if I don't eat a couple crackers kind of feeling. The thing is, that is something too, is actually, that is something I've been struggling with. It's been really freaky, and it's not exactly happening anymore. So I'm not getting the, my pain is not so attached to the Madi 2 situation, which is good. It's not supposed to be. I'm not supposed to be in fear of my life, from sleeping, you know, 8-10 hours or something, you know, or waking up afraid for my life. I'm not having the panic attacks like I was. I did wake up, you know, the last couple days, and the first thing I do is cry. And I allow that on myself, because usually I do, when I wake up, I get up out of bed, I sit down, get something to eat, like, I just don't stop, you know. You know, clean up my face and my skin and stuff, fix my hair, put my makeup on, and go out the door. Today, I made sure to flip over, lay on my stomach, and express what I feel, which is pain and confusion, and the normal reaction to that is to cry. So we had a normal emotional event, and even though it is not pleasant, it is still necessary and normal. So that's good. But like I said, I'm not having any lagging, I guess you could say. I'm not having any mental health episodes. I'm not having, I guess the best way to explain it is like pop-up emotions, which can be really terrifying. It's similar to a hallucination, except it's not a hallucination because everything is like, that's a normal thing to happen. It's almost like a fake situation that happened this morning that I'm talking about. So that's not happening anymore. Oh man. So like I said, I am ticking today. Really what it is my attention level is off because of the pain, so I'm trying to get my own attention. That is what Tourette's is for me. It's really weird. But I wanted to do this video in a moment where I feel pretty cognitively clear, even though I'm experiencing a lot of pain, and repeating myself constantly. I feel like, I don't really know, because my mind is kind of fuzzy. So, but it's a normal amount of fuzz, as I have been a woman my whole entire life, so yeah. Today is Monday. It is the 18th, I think that's what that says. Yes, it is the 18th. I am really, really, really not happy about having to be out of work this past week and for the next couple days. I don't know what's going to happen each day right now. All my bills are late, you know, that's kind of annoying. I'm still getting called up, but I have a rescue financial situation that's supposed to pop up next month. So no matter what happens, everything will be fixed in a couple weeks. So, and I usually am pretty good about like not having any not having anxiety. So yeah. So I should be feeling better soon. And then after that, hopefully, no, I'm not having any treatments, not on any medication. Cognitive, continuously, and having everything caught up, financially, and like stressors that I can control is I think the right way to word that. All of that will be fixed soon. Then I can start building. So I'm excited about that. Yes, today is the middle of the day on Monday, May 18th, and it is still 2026. And I hope everybody enjoys the rest of their day, and I hope this temperature stays really nice for everybody. It feels pretty good. The warmth, the sun's in a really good position right now, and so it's still a little cool. There's still a little bite in the air, and kind of like lizards on a rock feeling. That's the weather that is in May, around Easter, and we're still rocking that, so that's awesome. Yeah, hope everybody enjoys their day. Let's see if I can stop this. Been having problems with these buttons lately.